Hello again. Now we are going to talk about cancer survival. We talk about prevention, we talk about diet and lifestyle, for even treatment. Don't forget that I'm not pushing for treatment with diet and exercise. I'm just saying that this change in lifestyle is very important for any person that have the risk of cancer or have cancer. But now is an interesting topic, cancer survival. After a person is diagnosed of cancer or with cancer, after a person was done a treatment for cancer, surgery, chemotherapy, radiotherapy, immunotherapy, whatever, now what to do? And that's what we are going to talk about. And I will anticipate that what you do after you have the cancer, it probably is more important than what you did before you have the cancer. In the United States, from 1971 to 2001, the number of cancer survivors in the United States increased from 3 million to 9.8 million. The number of cancer survivors increased from 98 million in 2001 to 11.7 million in 2007. And now we are in 2017. You can estimate that at least 10 million more cancer survivors are there. So this is very interesting that the number of people are surviving more cancer than dying, at least in the United States. And the reason for that is better screening, early diagnosis, and better treatments. But we cannot skip the fact that probably lifestyle is already improving in some cases, in some places, and we know that people are not smoking that much in the country, and the smoking is the main cause of cancer. So if we consider smoking in 1950, you have maybe 40 to 50% of the population in the United States as smokers. If you consider smoking in 2016, is about 16%, and some states have even lower than 16%. So the reasons for survivorship is early detection, improved diagnostic methods, more effective treatment, improved clinical follow-up after treatment, and aging of the population. As I mentioned, healthy behaviors such as smoking cessation, healthy eating, regular physical activity can reduce the risk of cancer. And early detection of cancer can improve the quality of life and increase the likelihood of survival. Summary of the physical activity benefits for cancer. In fact, one of the main factors that we are going to talk in this chapter is not even diet, is physical activity. So these are the list of physical activity benefits for cancer. I took this from the book Lifestyle Medicine by Dr. Reap. That was one of the authors that I have used some of the citations during the course from his book. He wrote a big book on lifestyle medicine that goes to all diseases that are related to lifestyle and what can do to counteract those diseases. He had a chapter on cancer survivorship, and then he put all of these that can happen to people that exercise after they have cancer. So we could go to some things that are related to cancer just to figure it out, like the natural killer cell toxicity, cytotoxic activity. So when you do more exercise, you have more natural killer cell that will increase the attack to cancer cells. So if you go down the list, you have a better immune function. So this will be for sure increase the fight against cancer in the body. A better body composition, so skinnier bodies will decrease the risk of the cancers that are related to obesity in that case. Let's see what else we can find there. A better body image and self-esteem. Remember that I mentioned in the last part of my lectures about the stress and the depression that might be affected with that might affect the immune system and suppress the immune system and increase the risk of cancer. There are some reductions that can occur here, and one of them is reduction in all-cause mortality by exercise and reduction in the rates of cancer-related mortality. So this is evidence that we have already that people that have cancer, if they go by exercise, they have those symptoms that are clear, but they have lots of other effects. Physical activity is a panacea. That means that it is a promotion, is a medication for any single type of disease that you can imagine. Physical activity for cancer survivors is a good prevention for secondary cancers. Remember, once a person has one cancer, there is a high risk of other types of cancers. It decreases the comorbidities that might happen when a person has cancer, like coronary vascular disease, hypertension, diabetes, and osteoporosis. That if a person has cancer plus these will increase the risk of mortality, or the rate of mortality. It reduces the cancer-related fatigue, there is an improved sexual function, and reduces the incontinence when a person do more physical activity. Improve sleep. Physical activity reduce pain, improve balance, improve resting heart rate that will be slower, and improve hemoglobin levels. Is good for everything. Physical activity started after a survivor is diagnosed with cancer might exert a greater influence on mortality than physical activity engaged in prior to being diagnosed. Whatever, if we cannot understand that, maybe I cannot understand that, but what we know for sure is that you had cancer. Now you have a reason to do exercise. Why? Because we are proving that exercise improve your quality of life and improve your chances to overcome that cancer. What is the amount of exercise recommended? Exercise should be something that you like, and then 150 minutes per week, and do in a pace that you can talk, and 150 minutes per week would be like 30 minutes per day, 5 days per week. Or 70 vigorous minutes per week also would be advised. Resistant exercise is recommended 2 or 3 weeks, and resistant we are talking about weightlifting, and you don't need to lift a lot of pounds, but do some resistance exercise. And then stretching after aerobic and strengthening session is good to stretch the muscle, like doing some exercise that will help you to maintain the muscles in good form. The big problem is that the overwhelming majority of survivors of cancer do not do any exercise. 37% of breast cancer, only 43% of prostate cancer, only 35% of bladder cancer, and only 30% of uterine cancer patients met the ACSM guidelines for physical activity or the 150 minutes per week. And that is the minimal, We know today that when we have a problem, when we have a diagnosis like cancer or obesity or diabetes or hypertension, you should do 300 minutes of exercise per week to be using physical activity as a treatment. 300 minutes of exercise per week is equal to 1 hour of exercise during 5 days per week. 300 minutes of exercise per week is not that much, but people should do more on that. The thing is motivation. What are the barriers? I don't have the time. I don't have the money to pay for the gym. I don't know what to do. And nobody ever tell me what is the best exercise. I don't have the skill, the competence. I don't have any friends to do with me. One time I learned this term that once we don't want to do something, we will find 1,000 excuses for that. When we don't want to do something, we will find 1,000 excuses. So what we need to do to help is provide more information of the physical activity benefits for cancer survivors and develop for them a gradual program. It's important that a person it is very common that once you stay a long time without doing exercise, that you want to do everything in one day. That's not good. It's better to start walking, short distance, and then progressing gradually. Identify the barriers and provide the options and choices for the person to do it. I met a good friend a couple of months ago that had put one stent in the heart. He came with his girlfriend to my office, and his girlfriend was complaining that she was doing exercise and he was not, and was about 2 years after he put a stent, and he was having his belly was increasing, and then she was afraid that he would have another heart attack. And then before I was telling anything, I asked him, how is your exercise? And then he said, well, I used to run a lot, many years ago, and now I am not doing anything. I feel fatigue, I don't have the time, all the 1,000 excuses. And then his girlfriend mentioned like that, hey, I think we need to do exercise as a routine, as you need to brush your teeth, as you need to eat, as you need to take a shower. It has to be a part of your daily life. Otherwise, you're not going to do it. And then she was saying, I run every day. And if I don't run, I feel bad. I feel bad. It's not that I feel bad psychologically. My body will ask for exercise, so I need to do it. And that's the strategy that we have to use. At least that's the goal that we have to use with patients and cancer survivors. Also, there is a need for more cancer support groups. And then now I'm talking about church people or community leaders or the ones that are having hospitals or community centers to develop more on that. We have a lot of support groups for other areas, but we don't have many for cancer. So It's important to have this more in more places. It's important that the members of the support groups take ownership for that. It's important that they have more activities. It's important to have this in the society, not just for the penguins, but for human beings to prevent cancer. Physical activity, some of the activities, diet, stress management, spirituality. You can have lectures, but the good thing is when one person comes with an experience that he had improved in something and he had changed something on his or her lifestyle. I came that they might have life and that they might have it more abundantly. This was said by Jesus and is written in John 10:10. And this means that God wants us to have a life abundant. And He created us with muscles, joints, and nerves for us to be constantly in movement. One of the causes of cancer is because we don't do it. We don't have an abundant life because we sit. But now that a person has had cancer, a double reason is there for us to move. We were made for exercise, we got sick for lack of exercise, but we still have a chance. Let's go back to the gym, let's go back to the streets, let's go back to play ball, let's go back to do whatever, to go to our gardens and produce our healthy foods. Then we are going to do two things better for cancer: exercise and eat organic foods. Let's have a life more abundant. Thank you very much, and I will see you in the next chapter of the Cancer Prevention Seminar.